Hello and welcome to the Center for Functional and Integrative Medicine. My name is Dr. Mark Holthaus. I am a medical doctor in family medicine and most recently in integrative and holistic medicine. We are located in El Dorado County in Northern California in a small town just outside of Sacramento by the name of Cameron Park. I myself have about 18 years of private practice in family medicine, and some of the other practitioners here in the clinic, which I'll introduce later, have lots of experience in traditional and in integrative medicine as well. About 5 years ago, I began becoming disillusioned with general medical practice in the fact that it seemed like most of my patients were presenting with lists of symptoms and physical problems, and I in turn was expected to write prescription medications to alleviate those symptoms without really paying much attention to solving the underlying cause. I found myself attending a holistic medicine conference and finding that there was really another way to look at medical disease and to truly help people with their problems by going upstream from their symptoms to actually finding out what caused their problems in the first place. This functional medicine, as I learned it was called, appealed to me because it was very science and evidence based, but yet focused on that other perspective. Our clinic here focuses largely on functional medicine, the belief that all medical systems in the body, the immune system, the GI system, the endocrine system, the neurotransmitter system, and moods all interplay and communicate one with another in a web of interconnectedness. The Chinese with traditional Chinese medicine and the Indians with their Ayurvedic philosophies, as well as Native American healing traditions and others in different cultures, all have a similar belief of this interconnectedness. It is only our Western culture that I have come to find out that has a very segmenting and compartmentalization of the body and its systems. I understand that our healthcare system in this country is broken, and I'm wanting to, in some small way, be part of that fix. And I believe that that fix is only going to happen when we stop being part of a sick care system and instead move into the 21st century, which has more of a need for a health care system. Functional medicine, for me, is provided that methodology. And I'll tell you, I've never had to learn and understand and practice my biochemistry and physiology like I have of late. Some of the other practitioners that we have here at the Center for Functional Medicine and Integration are acupuncturists, are nurse practitioners, physician assistants, lifestyle educators, and practitioners of traditional Chinese medicine. Specifically, Mark Fierro, my physician assistant, has expertise with acupuncture of over 20 years, traditional Chinese medicine and herbology. He also understands traditional Western medicine very well, as he spent many years as a traditional physician's assistant in addition. I have a nurse practitioner by the name of Susan Caffery, who is a student of holistic medicine. She does a lot of our bioidentical hormone balancing. She has a passion for learning and adding holistic types of approaches to traditional Western medicine and has many years of traditional training behind her as well. Lastly, on our provider staff, beside myself is Cindy Swan. Cindy is our lifestyle educator who has a certified position instructing people in nutrition. She's also a certified personal fitness trainer. She has a 12-week program called First Line Therapy, where she takes patients interested in managing their cholesterol, their high blood pressure, their weight loss issues, their arthritis, their metabolic syndromes and diabetes problems and tries to turn them around, minimize the amount of drugs that they require, and really gives them their lives back. We have lots of support staff here. Beth, our office manager, Shannon and Angela in the front that keep things running. In the back we have medical assistants, both Brandy and Mary, which rounds out the team at the Center for Functional and Integrative Medicine. My areas of expertise, as I mentioned earlier, are functional medicine, which largely deals with nutrition, with exercise, with stress management, with biofeedback, using the mind-body connection to lower cortisols in order to optimize our immune function and our endocrine systems. I deal a lot with adrenal and thyroid balancing, with bioidentical hormone balancing, with neurotransmitters, things that affect mood, anxiety, and depression issues like norepinephrine, dopamine, and serotonin. We have a unique approach in that we like to be able to offer patients that need the time for a half-hour, 45-minute, or 60-minute appointment the luxury of having the time to tell their story without the pressure of insurance breathing down our necks to force us to see people every 5 or 10 minutes, as many doctors in this culture are having to do to keep the lights on. We also have insurance-based visits for more traditional care, which end up being a little shorter as dictated by the insurance companies. I think that we've got an incredible program here that's very unique. There are other cultures that have clinics like ours. We are the only clinic in the El Dorado County area that I'm aware of currently, and the greater Sacramento area for that matter as well. We would love to have you come, let us be part of your trek back to health. Neither Mark Fierro, Susan, or myself, nor Cindy feel as though we are the source of your healing, but certainly we can be part of the team along with yourself to get you back to optimal health. We rely on your participation as much as anything. This clinic is not for those who just want to simply take a pill and kick back and keep living the way they have been. If that's your attitude, this is probably not the best place for you. But if you're somebody who's interested in looking at things differently than just using pills and medications, and are interested in using both traditional medical tests as well as functional medicine testing, which goes far deeper than many of the traditional tests to figure out what exactly it is that's keeping you from your ideal health, this is a good stop for you, and I would love and be honored to have you come give us a try.